From the moment we enter this world, we encounter meaningful moments and inspiring opportunities to live our best lives. Along the way is the chance to create relationships that shape who we are as a person. During our time on Earth, we look for love, compassion, and most often, a sense of purpose. And when it starts getting close to the end of our journeys, we want to feel like we made a difference and, if we're lucky, can somehow live on. These are all truths we've learned from people working side by side those at the end of their life. On this episode, we'll learn how Desert Oasis Healthcare is helping people accomplish all of that. Hospice and palliative care do not have to be a terrifying conversation or concept. And the people you'll hear from today want you to know why. And they want you to know how they show empathy and comfort in moments that could be difficult. We hope you can witness the beauty of human connections and purpose that will inspire you to live your time on Earth to the fullest. Welcome to The Pulse. Seeing our loved ones in pain or losing a loved one is undoubtedly the hardest part of life. And I appreciate, Dr. Segil, you being here to talk to us about the peace that you're able to bring to that process, that phase of life, because it's an important conversation to have. So thank you for being here today. I appreciate it.
Thank you for having me.
I found it interesting as we were talking before this conversation and just me trying to better understand hospice. You said you're almost hesitant sometimes to use that word. What is the misunderstanding around that word, hospice?
Well, it's always a difficult time in a conversation, but I feel by just asking somebody, do you want hospice, doesn't really capture the patient's story. And I feel that patients, when they hear that word, they feel that it's about just nothing else we can do for you. We're going to close the door, and then that's it, which is a big misconception.
People think seems like you're giving up, but it's not about giving up. What is it really about?
It's about giving you more. For patients who are on hospice, they have a terminal condition, usually about 6 months or less. And although there is not a cure any longer, there is always the opportunity for more care. And care is really what's essential during this last phase of life, because it's difficult for patients to go through, and it's very difficult for families to go through as well.
What you're doing, seeing some of the hardest parts of life, takes so much strength. And the way you got into this, I find very fascinating. And I appreciate you agreeing to share a bit of this personal story we're going to talk about. It really starts with your mom.
If you ask physicians why they became a doctor, they'll give you all kinds of reasons, such as I want to treat disease, or I want to make patients feel better. But my reason was because my mother told me so. At the time, I asked her, how do you know? Why? And she said at the time, we may not know the answer now, but I know this is going to be true. We didn't realize the answer until 50 years after that conversation. My mother was a very petite woman, but she was larger than life. She liked to dress, she liked to have her hair, she liked to socialize, live life to the fullest. And they lived next door to me in Long Beach, California. So I saw them often. And then one day while I was working in the San Fernando Valley area, she called me and she said, I've been having this abdominal pain. I don't know why, but I went to the doctor and my doctor ordered an ultrasound. She hasn't called me back yet, and I was wondering if you could help me find the results. So with her permission, I called the radiologist who I knew, And after I called her, there was this silence. I literally remember being in my car and I held on to the seat, just waiting to hear what was going to happen. And then the radiologist told me hesitantly that my mother had metastatic pancreatic cancer, which is a devastating disease for anybody. So, my heart's pumping very hard and I had to brace myself again. So I called my mother's primary care physician, and I asked her, "Did you tell my mother yet?" And she said, "Well, I'm about to. So I was in the San Fernando Valley, which is about, 40, 50 minutes from Long Beach. So I rushed to get down there so I could be there with her after she heard the news. So I remember it was this very clear December day, Southern California, blue sky, a little bit cool. And I approached my parents' stoop and I saw them walking inside. So I rushed and I gave my mother a hug, not knowing if she knew yet. And she was always happy to see me. She had the big smile and she's had some little chit chat because they were in Costco and they were shopping as they usually do. So I thought something's not quite right. This is not somebody who had just heard a very bad diagnosis. So I asked her, did the doctor call you about the results? And she said, no, because they were out shopping. They hadn't gotten to it yet. So again, time stopped. I realized I knew something. She didn't know something. Who was going to tell her?
Do you play son or do you play doctor?
Do I play son or do I play doctor? And it was, I had to think very quickly because I couldn't not say anything. But what was I going to say? So at the end, I thought I owe it to my mother to tell her. If I had to be the one, then let it be me, because that's what was supposed to happen. And I told her that she had metastatic pancreatic cancer, which was already too far gone. That was the start of our journey together. Now, she went to the oncologist, and the oncologist also told her there is no cure, but they could try chemotherapy, they could try these other experimental things, but they would have side effects. So it was my mother's decision, after hearing all the facts and with our support, that she decided that she didn't want to undergo that if she knew that the end was still the same result. So she decided to forego everything. At that point, she did ask, well, now what? What happens now? And when I spoke with her, because I have been involved with very complex cases and previously with a lot of patients who are terminal, I said, well, although we don't have a cure, there's always care that we can give you and support us as we go through this journey together. So we talked about hospice.
And at this point, you were working in hospice for how many years?
I've been a physician for 35 years, and for the last, I would say 10 or 15 years, I have been working with hospice patients. I eventually changed over to be a full-time hospice physician as a result of what happened to me personally.
My family and I had to make the difficult decision of putting my grandfather on hospice when he got COVID at the peak of the pandemic. And to your point, hardest thing I've ever experienced so far in my 35 years of seeing all of that and experiencing that. But I remember, even though the care was, of course, for him, we all required so much hand-holding and understanding and trust of that process. And it makes me emotional to think back to that. Can you explain a bit? Of course, what you're doing is for the patient, but you're really working with those families as well. to handhold them through this time?
It's not just the patient, it is the families as well, because they're watching a very difficult thing. And they're with the patients 24/7 many times. I am not there all the time, but that's where hospice can help, because we will handhold them through this entire process. Sometimes we don't need to be there all the time, but sometimes we do. Sometimes they need to hear from a spiritual counselor or a social worker more than they do a physician, and that's where we help as well. The better that patients and families are prepared, the easier the grief is. Now, grief doesn't go away. I don't think it ever goes away, to tell you the truth. Because you love somebody you remember, you're not going to, you honor them by grieving. But there is a better way to grieve if you are able to accept it ahead of time. That's the beauty of hospice benefit, is that gives, the longer you're on it, if you're on that 6-month period, the longer you're on it, the easier it becomes to accept.
Michael, what you have chosen to dedicate your life to as a spiritual counselor, bringing peace and comfort to people at the most difficult time of their life, is just so commendable, and it just shows you have such a big heart. You clearly have chosen a life of service, so thank you for everything you're doing here for the community.
Well, thank you. It's what I'm called to do, and so that's what I show up and try to do my best at.
Let's just start with, what does it mean to be a spiritual counselor? What do you do?
My role primarily is to show up with individuals that have been given a terminal diagnosis, and they've decided that they want care and comfort rather than trying out really aggressive treatments, or maybe the aggressive treatment is not available for them. And so we work as a team. We've got the doctor, the nurse, the social worker, volunteers, and then of course the spiritual counselor. And we reach out, so when someone chooses to come on to hospice care, we reach out to them and introduce ourselves, explain to them that we're available. As a spiritual counselor, I will show up and do in-person visits. And if they're of a specific faith and they want to make connection with someone in their faith, a rabbi or a priest or a minister, then I will help them reach out and find that. We've got the connections in the community with those individuals. Or if they're just wanting someone to listen and be with them, pray with them, read scripture, or just have social conversations, that's what I show up and do.
It's just such a critical time that you're there to help navigate. I'd have to imagine you're not just there for the patient, but for the families too.
Right.
Explain some of those conversations.
And oftentimes, when we make that initial call, even though they may have been given some information at admission, they get so much information they don't retain all of that. So we make the call. They don't even know what questions to ask at this point. And the family oftentimes is really overwhelmed because they've been dealing with the caretaking. They've been dealing with appointments and what to do and where to go. And oftentimes they haven't even thought about the emotional, spiritual part of it. And so that's what I get to open up to them, is say, there's going to be a lot of thoughts and questions that will come up for you as you go through this journey. And we can kind of prep you for that and let you know what others have gone through in their experience.
If you could help people understand one thing that you feel is often misunderstood about family hospice care, what is that?
People feel like that's just the absolute end. And what family hospice care is trying to provide is that we don't know how much time each individual has. When you're faced with that terminal diagnosis, you don't know what to expect. You don't know what to think. And oftentimes people haven't developed their spiritual background in a way that prepares them for facing this inevitable experience that we're all going to, at some point, have to face.
You know, we live in this world where it's just achieving, wanting more, having more, getting more, the things, what we think we need to make us happy. To have lived a life well lived, we must have this, have accomplished this, have done this. You talk every day to people who are at the end of their life. And in an effort to hopefully inspire all of us to understand what really matters, I'm curious what you can share about what these people have said when they look back at their life. What is it that truly determines whether or not they felt they had a life well lived?
Most people come to that conclusion that, the material things, though it's nice to have them and they really bring a lot of comfort, when the moment comes to where, what is my whole life experience been like? Oftentimes they're asking, have I lived a good life? Have I done the things that I was meant to do? Did I leave anything left undone? Even though their time may be limited now, there's still life to live. They can still create new memories. And it's an opportunity for family and friends to engage with them in doing that, in creating a new memory that's life-lasting.
What exactly is a doula for those who don't fully understand?
A doula, end-of-life doula, spends time with people as they're preparing to pass, to transition. I prefer to say people are transitioning, but you have to respect cultural.
Sure.
Some people want to pass, some people die, some people transition. So whatever the person speaks, that's the language I try to speak. But I be with them to make sure that the dying process is a very spiritual time for the family and the dying person. That it's a time of love, it's a time of connection, it's a time of forgiveness, of the person forgiving who they need to forgive and being forgiving if they merit some forgiveness from somebody. And I spend a lot of time going over their life, doing an intense life review. And that's where the forgiveness comes in, because we don't want people leaving this life with regrets. That's not a good way to go on to wherever they're going to go, having regrets about what happened here. So if there's some way to undo those regrets, we do that.
People who don't understand some of the next steps, or they're afraid themselves of hospice, or they're afraid to make those calls. It seems comforting to know they have a lot of, I'm talking about the families here, they have help from people like you to help the families navigate these hard times as well, right?
Oh, for sure, yes. As a doula and even as a volunteer, oftentimes what I'm doing when I volunteer is just to be there so the spouse can go do the grocery shopping or do whatever they need to do. Caretaking is one of the most difficult, demanding jobs that there is. And if your loved one is in bed, very sick, dying, and you're the caretaker, tremendous stress, and you need to have a break. As a volunteer and as a doula, I establish a relationship with the patient, the client, their family, and when they pass, when they transition, I started thinking about that. Well, I was in their life, they were in my life. I would like to maybe, how am I going to
Memorialize
remember
that
them?
relationship,
Yeah.
yes.
And so I started trying to write poems.
Can you read one for us?
Sure. I like this one. I remember this guy very fondly. The musician.
Okay, I know. The memories, tell me what you're feeling here. It's the relationship you had with him.
It would have to do with my relationship to him and how much I helped him.
He seemed to have left a different impact on you, though, than some of the other people you've worked with. What is that?
I think I kind of liked him, independent of just being there for him. I would have liked him as a friend, I think. I think we connected.
Maybe you wish you would have gotten more time with him.
Yeah. All right, I think I can read it. The musician. The cancer in his head rapidly devours his brain. Our chats about his life and music soon turn to grunts and groans. His wife buzzes about the house, sweeping, dusting, moving things around, unable to protect the life she loves, her feelings of powerlessness hidden by the activity. He once played a Gibson guitar, wrote music, and sang his own songs. Stiffened fingers and gasping breath now crush those treasures. In his final hours, she holds his hand, sings his songs, her tears mingling with his.
Oh my gosh. That's really beautiful.
I'm surprised at myself.
It's such an important service.
Yeah.
You're living a life of service, clearly. What you're doing, the peace and comfort and solace that you're bringing people at the most difficult point of their lives, many of whom have no other family members, as you know, it's so commendable, and just thank you for what you're doing. And it's interesting, you see on the news all the time, people in the community doing wonderful things, and it's often related to nonprofits, and that's wonderful. But this is something that I don't think anybody ever knew, this job and how critical it is, and the impact you're making in the community and people's lives. So I just want to point that out.
Thank you.
One thing unique about Desert Oasis is that part of the system of care is to get patients involved early on so that their wishes, their goals, what's important to them, and having the best life possible is discussed and it's documented. So a unique program we have, for example, is something called life planning. It's literally what's important to you in your life, no matter what stage, but especially if you're more ill. And it's trying again to get your feedback, putting it all together and saying, this is where you are in your health, and I'm glad you're healthy. And this is how you can stay healthy. But you know what? In order to stay healthy, it's important for us to know your goals and your values as well. So let's have that conversation.
Right. So we've been talking about hospice in this episode, but I want to take a step back for a minute, because before somebody even decides to pursue hospice, they come and talk to a life planning specialist, such as yourself, Dr. Sakian, and understand their options if that's the route they want to take. Life planning, explain why people come to you, at what phase of their life.
Life planning, it's something that we started about a year ago when we recognized the need of having the patients and their family just come and have an honest, open, and comprehensive conversation about everything that is happening. Dealing with serious illnesses or chronic comorbidities can be very challenging. So what we do, we offer an opportunity to come and talk to me. The way that we see it is literally as a conversation where we talk to the patient, we talk to the family, and we talk about as many aspects as we can. And eventually, what we want to do in life planning is to empower the patient to make decisions regarding how they would like to see them moving forwards, knowing the things that they know.
How do you answer that question then when somebody is trying to determine if they want to keep fighting?
I've encountered multiple times, actually, like I said, almost every visit, especially if they pursue the comfort route. They tell me, okay, so how much time I have left? I try to avoid as much as I can to give a certain timeline, because I take my role as a physician very seriously. And once you give a time, it's going to stick in their head.
Right.
So I tell them that usually when we give a time, it's a guesstimate. Like if I say 3 months, they can always ask me, why not 1 month? And I won't have a good answer. It's a hunch, it's what I think. So usually the way that I approach, I say, if you are to pursue comfort route and we are foregoing any type of invasive or aggressive kind of intervention, and all we would like to focus is quality of life, comfort at your own house, bringing the care to you, I would just take every day that you feel well as a gift. During your journey, I would say that in general, when you qualify someone for hospice, we're talking about 6 months or less. But I tell them, don't focus on that. Just enjoy the time you have. And when the time comes, if your symptoms will become worse, then you have the adequate support to try and control the symptoms so you can live the best time that you have, and the journey will be smoother compared to pursuing aggressive treatment, which may be appropriate, but we have a lot of unknowns.
Sure. So this is essentially a patient coming to you who's just received this devastating diagnosis, and they're trying to decide, can I live with this? Can I treat this with a decent quality of life, or do I take the other path? And as we said, entering into hospice. Tell me about how you help somebody navigate that decision. I know you're not making the decision for them.
Correct.
I'm sure they're asking you a million questions like, what do you think I should do? What do you think I should do? How do you navigate that?
What we do, we are trying to talk about the pros and cons. So I'll give an example. The easiest example to give will be an advanced stage cancer. That's something that we see very often. So then they will come. I will be reviewing their chart in a very thorough manner. I will come ready with recent scans, recent labs, and then we sit, and then I present to them all the information. I'm like, okay, this is what the last scan show, and that's what it means. From there, we are talking about what options are available. For advanced stage cancer, we talk about the possibilities of treatment in general. Do we want to do chemo? Do we want to do immunotherapy? Do we want to pursue surgery? And then what are the general risks pursuing aggressive treatment? After we present all that to the patient, we explain to them that they have several services or options to choose of how they would like to proceed. And I see my role as a physician as an educator, and the one that will listen to what the patient wants to do, and then we will provide the best or most appropriate service or support based on their decision.
For people who are facing a devastating diagnosis right now for a loved one, what would you say to them?
Call us through your family doctor, your primary care physician, through your case manager. If you're having difficulty, Desert Oasis is an integrated system. So wherever point of care that you access, whether it's the immediate care, whether it's the specialist, whether it's the emergency room, you're always going to have someone to help you. And all you need to do is call Desert Oasis telephone number, and they'll be there.